laboratory outside, and I had to let one go. I didn't have enough business.
Welcome Dr. Guttman back to Sacramento and to our first oral history interview. As a background, it's evident that our retired physicians are really a tremendous repository of information, anecdotes, and philosophy related to the history of medicine, particularly in our area, in our community. And we as a history committee would like to preserve this for the utilization and the benefit of the physicians in the medical society in the future. Dr. Guttman, maybe, let me get the pronunciation right, sir. Is it Guttman or Guttman?
Guttman.
Guttman, okay, thank you. First of all, if you can tell us a little bit just about your background as far as where and when you trained and when you went into your specialty pathology and when you came to Sacramento and when you left Sacramento.
Well, I came here in 1934, having spent 4 years at University of Minnesota under Dr. Bell in pathology, where by nature of the fellowship we had to work for a PhD degree after obtaining our medical degree. And then I spent a couple of years in the University of Colorado in the Department of Pathology teaching. But the income there during the Depression was very, very poor, and I couldn't support my family on the income, so I looked for other outlets. The only thing that of interest is that, having no reserve, I was fortunate one day to receive a commission to do a postmortem on two youngsters who died suddenly from very obscure causes, for which I received a sum of $100. And although I spent 3 months trying to find what killed these two kids, at that time we were still thinking about status lymphaticus. Well, some constitutional disorder of some sort, or anesthetic death, we didn't know. But nevertheless, I had $100, and that brought me to Sacramento, a move which I never regretted. I started the Sutter Hospital in 1934 in March. That's exactly 50 years ago. I may state without reservation that my tenure in the hospital and the administration was the most pleasant experience in my life. It was never a rough time. The cooperation that the staff gave me in Brisbane, and many of the others, was really great. Well, now, I could say a great deal about practice of pathology those days, clinical pathology. In those days we felt sort of more in the line of giving a service to the hospital and to the patients. And we never thought of charging for an autopsy. We never charged for biopsies until later. We were always up in the surgery working with physicians. There was a very close relationship between pathology and the physicians, and very productive and very, I felt, useful purpose in the work. Those days, I think, were very interesting days. They were the years of awakening of the profession with the innovation of ideas from year to year, which had to be incorporated in our work. Among many things was the RH factor, for instance, is one. The recognition of the part played in the deaths of infants and in transfusions. The establishment of blood banking, which occurred in the early 40s, I think Sutter Hospital was fortunate to have the first hospital blood bank in California. We opened our doors about the same time as Irwin Memorial. In fact, I think I beat them by a day or two. But nevertheless, we profited by each other's experience. Beatrice Hempel at the San Francisco Medical Society Blood Bank started about the same time I did, and she was a tremendous influence on the development of a blood banking system throughout the country. I remember our first meeting when we organized the American Association of Blood Banks was held down in Houston, Texas. And there were a group of us, about 10, 12 of us, and we formulated the bylaws, which later became the bylaws of the society that developed afterwards, the American Association of Blood Banks. Little we didn't know at the time the tremendous growth that took place, but we did establish certain things which I feel that I had a little hand in. I felt that blood banking should be a non-profit operation. This was shared by a fellow pathologist who made a pretty good living out of blood banking. They would charge as much as $100 and $125 for multiple syringe transfusions. So I became a sort of an outlaw in the eyes of my colleagues. But whether I did it or somebody else did, the time had come for a change. So then we went on to develop a California Association of Blood Banks, a group that met regularly, discussed our problems, technical and administrative, and it was a very closely knit group, and we learned a great deal from each other. In the early days, where the hospital blood bank was the only source of blood, we were limited more or less to the needs of Sutter Hospital, but we began to supply other areas. And I remember during the war, there was a sad need for plasma, and I accumulated a lot of frozen plasma, but I had to compete with the Red Cross. They wanted to do the entire job. But Upton, Dr. Upton, who passed away recently, got around them, and we sent quite a bit of plasma into service. The idea of transferring the hospital blood bank to the county hospital, the county society, under the medical foundation, is that right? County Medical Foundation, Dave, came about 2-3 years afterwards, and I convinced the Sutter staff, the Sutter Hospital, that this thing could be better handled by a special organization devoted to blood banking. And we proceeded from there. Now, I don't believe people remember the part played by certain members of the society. I'm thinking of Dr. Hopkins, Dr. Harry Cantor, Dr. Dudley Seltzer, and Dr. Aphasia here. I'll think of another name soon. But there were several men who were really the backbone of the project, and we had no money. We really had no money, but managed to. Dr. Harry Cantor managed to dig up $15,000. This is all we had, and the city gave us the tower, and all the carpenter work and decorating and so on was done by local services free of charge. So we had a very, very nice little blood bank for very little. And of course they were flooded with volunteer workers. We ran it with 3 technicians at the beginning. We soon had a mobile unit, which we pulled in all the rest of the communities throughout Northern California. And from then on, the blood bank flourished until you see the immensity of the operation at the present time. So it served a very useful purpose. The other thing I'd like to talk briefly about is, I've been requested to say something about the library. I've been, I had very little to do with it, really. I started the library in my office way back in the late 40s, I believe. I can't remember the exact time, but I got the members of the staff to donate $2.50 a month, which was to go to the library fund. And I requested from each specialist what they would like to have in journals, and we started getting journals which accumulated in my lab, and I must have had 30, 40 or more journals. At the end of the year, we'd bind them, and we'd have them on in the doctor's room. Each month we replaced them until they until my little office was couldn't handle it anymore. It became loaded with journals and whatnot. By the way, Von Geldern, our dear old friend Von Geldern, donated Index Medicus. And perhaps this was one of the factors which led to the establishment of the library, because Boyers and Simpson looked at Index Medicus and thought, well, wouldn't that be nice if we could put this in our new building, you see? So having my hands full with other things, I felt I'd played the role of library secretary long enough, and I induced the people at Sutter Hospital to let go of the library. They weren't very pleased, I'll tell you. They felt I was selling out Sutter Hospital. But there again, they were very kind to me, and they acceded to my wishes. So actually, the library was started by a committee, a library committee in which Simpson and Boyers, I don't know who else, Dave. Do you remember who else was on that committee?
No, I don't, really.
Well, anyhow, I think it was Simpson who got the idea that my name should be on it, for no good reason, because after it's transferred, I did very little or nothing to help the library. I had other things to do, and it's just developed on its own initiative. So we have now a beautiful institute, and I'm glad you kept it here. I understand there was a period in which the medical school at Davis almost ran off with it, if I'm not mistaken. And it was only by a narrow margin of vote that we kept it here. And I think it's good that we had done so. I have really much more to add. Unless you have some questions, I'll be very glad to answer them.
You had a comment, Dave?
I'd like to help Paul in what he has said about a number of things by asking him some fill-in questions. Now, my best recollection of when you came to the Sutter Hospital in 1934 was we were running no more than 80 to 100 patients in the hospital. You found there were about 3 technicians in the laboratory. There was a downtown laboratory in the medico-dental building with 1 technician. Is that right?
There were 2, but I couldn't afford 2.
You couldn't afford to. And is it your recollection that nighttime the girls went home and we virtually had no laboratory services from 5 p.m. till 7 a.m. the next morning? Is that your recollection, or did we have a night?
You mean at Sutter Hospital?
Yes.
I think we had technicians on call
Yeah.
at all times.
Yeah. About the blood bank, I think Paul has understated the thing a little bit, because actually he had rooms not much bigger than we're sitting in right here, and he was taking blood from dozens of donors in the first year of the war. That is 1941, 1943 when I left. And I used to see him in there. Here he was with his a low psychiatrist's couch almost, taking blood in this little 2x4 place. And the blood was taken and it was distributed by the Red Cross. That's where the Red Cross got into it. And the Red Cross got real enthusiastic about all this thing they were doing, and they got a lot of glory out of it from Paul's work, because Paul, I don't think Paul Guttman was taking blood over at the sisters to any degree at all. And yet thousands of units of blood were taken right in that little cramped corner there in the Sutter Hospital. When the services were, when the war was over, we had 3 men who had been in the 51st Evacuation Hospital, Dudley Seltzer and Jim Yant and Andy Henderson, and they had come in with the importance of blood, and Yant and Seltzer in particular, being surgeons and knowing the urgent need of plenty of blood at certain times, they were on the committee. I was on that committee too. Meantime, the Red Cross had collected a fund of $65,000 to start their own blood bank. And they didn't want to do that, but they wanted us to start one with their money, and they'd get the glory. Well, by that time, Paul and those who knew of blood banking practices knew that if we put in a blood bank here under the control of the Red Cross, we would be working from rules out of New York and the East, and there would be a lot of things which we might want to do that we couldn't do, and a lot of things we had to do that we didn't want to do. And it was due to their position on it that I never forget, Jim Yant and Dudley Seltzer and myself took Nate Sellers, the head of the Red Cross, and he had the Coca-Cola thing here, down to the Sutter Club one evening, and we argued for 3 hours, and he's trying to get us to sign up with the Red Cross, and Nate built us a blood bank. And we wouldn't do it, and he went away from there just madder than hell, thinking we had a bunch of stupidest damn fools he'd ever heard of. But we started a blood bank. Dudley Seltzer went down to their unions. You know, working men as a class, in an impersonal manner, don't think much of doctors. But he faced those unions, and they gave blood. They gave their services. He went to the Building Trades Council, and he got the materials, and we got a notion that it would be a good plan to put it in the base of one of the water towers, and temporarily that wasn't bad, and the whole thing got off to a good start. But through all of it, you could see the fine Italian hand of Guttman telling them what to do and calling the shots. I'd like to comment further, if you permit me. Now, library, when the Sutter Hospital Library, when Sutter Hospital was opened in 1923, a lot of the doctors brought their old leather-bound books. We had the doggonest collection of moth-eaten leather-bound books you ever saw in the board of directors room on the first floor, and that was our library. And we had a few magazines come filtering in from time to time. And then, just at the time of World War II, we began getting the notion of really collecting the magazines and getting a library in a better place. The building on the corner of 28th and Capitol Avenue had been the home of a lawyer's family, and that was our first medical society headquarters. And we had the first exchange upstairs, and downstairs they moved these carloads of magazines that Dr. Guttman had preserved and protected and hung on to, and virtually all the obsolete material that was in the old library in the Sutter Hospital was taken away, which is a proper thing. We are particularly honored in this man who had, first in his profession, secondly in his blood banking, thirdly in what he has done for the library. And there's one part of two parts of his life that some of you may not know about. But he virtually put his way through medical school playing the piano. He can play anything from Beethoven to boogie woogie and back again, and just make that piano do anything that you could ever ask for. And we've spent many hours listening to him playing. Similarly, in these years of living in San Francisco, he was doing research work at the UC Moffitt Hospital, and at the same time he was doing painting, and he belonged to the American Association of Physician Painters. And you had a few exhibits in that, isn't that right?
Not particularly, not formal exhibits.
I'd like to ask some questions. But when did it become standard that you had to have a blood count and a urinalysis on every patient that came into the hospital? Was that policy from the beginning? Or?
Yes, I think it was mandatory. The American College of Surgeons demanded that this workup be done. But the bill to the patients, I think, ran $2.50 and included a prothrombin and a urine hemoglobin and a white blood count, something like that. But in those days, you must remember that the hospital cost per day in those days not between $8 and $9. You remember?
$4 for a ward rate. We had all of our industrial accident cases on First East, and the rate for those beds they were all ward beds. They were $4 a day.
In those days, the cost of transfusion, including the blood, cross-matching, and so on, was $7.50.
What chemistry did you do?
This was nationally, became a part of the national policy, the $7.50. Hempel and our group at the meeting down below established that as a basis, and that the operation of blood banking should be non-profit, which still exists today, I think, in most members of the American Association of Blood Banks have operated on a non-profit basis. But those were different times. Changed. Blood banking has become much more sophisticated. Much more technical knowledge is necessary now, and the cost of services have gone up tenfold, so that it's a different story. It's happened in all phases of medicine. That I suppose blood banking still is a very reasonable operation compared to other phases of medical practice. Don't you think so, Dave? I don't know what cost.
I'm retired now, 15 years. You'd have to ask.
I guess you can answer that question.
When did you quit giving a blood? When did you stop doing direct transfusions?
It was shortly before blood banking. I remember we used this anticoagulants. We'd match the patients, and the technician would remove the fibrin. We'd run the blood in directly from a vial that we took the. We didn't do multiple syringe method. We used a method whereby we introduced an anticoagulant and gave it directly on the operating table.
My best recollection is that we got the citrate method of transfusions in about 1930.
Well, we didn't drop it until about 40 some when the blood bank system came in. That's the only method we had available at the time.
What chemistries did you do besides calcium and a few things like that?
Well, we had methods. We had. When I left, we were just beginning to automate things, and
You didn't automate.
we used the tedious methods for each chemistry in the laboratory, but the demands were limited to just a few determinations those days.
When you came to the Sutter Hospital, were you doing fasting blood sugars or blood sugars at all?
Oh yes, of course we did.
And
We did
non-protein
glucose tolerance tests.
In 34?
Oh yes. Mm-hmm.
My best recollection was that we didn't start in doing those simple chemistries until about 29.
29.
Yeah.
Well, I came in 34.
Yeah.
And by that time we were doing a lot of chemistries, uric acid, cholesterol, all the nitrogen, blood levels, sodium and potassium. But these are laborious methods that took a lot of time. And I never did trust my technicians to do most of them. I don't think I did any better than they did. But I didn't have the properly trained technical help. And I wasn't sure that they would do it well enough. But then we didn't have, in those days, we didn't have quality control either. So there's no question that we a lot to be not lacking in our diagnostic, but we did the best we could.
What was your first pregnancy test?
What's that?
What was your first pregnancy test?
Oh,
Rabbit test?
yeah, we started rabbit tests. It was in vogue, the Aschheim-Zondeck. And that was, I must have done a half a dozen of those a day. And I had a German fellow who got rabbits for me. And after doing the test, he would take the rabbits home with him. I didn't know what he did with the rabbits. Well, one day the health department came to me and accused me of collaborating with this fellow in processing blood sausage. He made sausage, German sausage out of that. He got blood from the abattoir and mixed it up with the rabbit meat and made a very delicious sausage. And I told him, I said, I wasn't aware that this fellow was doing it. He was forced to quit it, of course. They didn't put any formal charges against him. But he must have done pretty well, because when he died, he left one of my technicians $25,000. Profit from the
pretty well.
profit from the Ashanti.
He's a little short, squatty fella. And of course he had on farm clothes, and he used to come muscling into the hospital back door with a gunny sack over his shoulder with about 6 or 8 rabbits every morning.
Well, the frogs came in later on.
Yeah.
We had the frog test. It was a good test as long as the frogs were cooperative, but they had seasonal variation in their ability to respond, and began to have false negatives creep in on us. Now you have a much more simple test for it. Well, those were the days that we had to do with what we had. But they were interesting days. I felt that the first 15, 20 years of my practice there were exhilarating, stimulating, and productive. I enjoyed it. I really enjoyed practice here.
You mind if I tell a story about you?
As long as it's not too good.
Well, this is a story. Ralph Graham was our radiologist, and he had a ranch out towards Fair Oaks. And he was riding on his truck, went under a tree, and when they got past the tree, Ralph was on the ground. And he got a slight compression fracture of one of his lumbar vertebrae. So he had his kids throw him in the back of the truck, and he came right into the Sutter Hospital. Ray Haig was our orthopedist, and Ray took a look at it, and he put him in a concrete jacket from his axilla to his hip pockets. And Ralph was on the job the next morning in X-ray. Sterile, you know. And sometime later, one P.H. Guttman was out making a house call and getting a blood count. Well, that says something. And it was raining, and he slipped, and he took a bilateral compound pratfall, and he got a fracture in his lumbar spine. So he went on over to the hospital, went in, X-ray showed it. Haig put him in a concrete jacket from his clavicles to his iliac crest. And unfortunately, Paul decided to get an acute attack of gas. He filled up with gas out there like that.
I had a hiatus hernia.
By the time
The old hiatus hernia.
he was a pretty miserable doctor.
I had a hiatus hernia. I couldn't stand that pressure here. Well, they kept me down for 4 solid months. I think he did that to just make me feel miserable. He had that type of personality. He's a nice guy, but he had a very sadistic sense of humor. So I suffered another compression fracture about 2 years ago. This is bad. And the doctor treated me. He says, well, let's go home and it'll ease off. It'll heal in time. Never incapacitated. And I remembered, hey, keep me down for 4 solid months.
Did you do postmortems in the 30s? Did you have a good percentage of postmortem examinations, autopsies?
Well, we tried to do as many as we could, and we had pretty good cooperation. I don't know, what is the percentage now of postmortems?
We run 15 or 20% today.
About how much?
15 or 20%?
20%?
15.
I think we probably did a little better than that. I can't give you the exact figures on it.
When did you start doing frozen sections? When
When did you start doing frozen sections?
Oh, wow, we did frozen sections in 1934.
I think you brought it to town. I don't think we'd ever done any before you came here.
No, we had frozen sections right away. I remember, do any of you remember Bell, the surgeon Bell?
Yes.
Leo Bell.
Leo Bell was a very capable surgeon. He was a brother of the pathologist under whom I studied in Minnesota. And he always gave me credit for knowing a great deal more than I did. Because when he would take a biopsy for me, it'd be so damn small that you could barely see it. And he says, Paul, put that on the microscope and see what you find. Well, I sweated blood over those days. And, he would impose on me to do these things. But on the whole, we had very close cooperation with the medical staff and surgeons. Very good, wholesome cooperation. And many times, you know, we couldn't come to a conclusion on the basis of a frozen section. It would require more study. And we had to stop the operation, hold it over. Did that to you many times, didn't I, Dave? I think that it was good to know that the men understood these episodes where I said, no, I can't tell you now. We've got to wait and get better sections. And from the standpoint of the well-being of the patient, that was highly desirable. But we had wonderful cooperation from the doctors. I don't think you would get it now. I think they'd want an answer whether you knew what you're talking about or not. All right?
Did you feel that you saw the trend, for instance, of tuberculosis fading out over the years? Did you sense that tuberculosis was dying out? And on the other hand, did you notice lung cancer coming in?
Well, I was in a position to observe the statistical rhythm of things because, after all, I had a limited activity in these various fields, so I had nothing, no baseline to go on.
I mean, you did gross pathology, didn't you?
Yes.
As well as the other things.
No, I don't think we saw too much tuberculosis in California, in Sacramento. That wasn't your experience.
The tuberculosis, the people who died of tuberculosis here in Sacramento died in the Sacramento hospital. Right, and in Weimar. But it was interesting. I can remember that I had a youngster with tuberculous disease involving the right lower lobe, and we had a fellow by the name of Dillon here as a surgeon, Joe Dillon. He was out of New York, cocky Irishman, and the day after Pearl Harbor, old Joe went down and signed up. He did a decortication on this patient's lung for me in the Sutter Hospital. And we saw very little pathology from the standpoint of surgical pathology in the Sutter Hospital. And of course it wasn't until after World War II when Jack Baker came to town that we began our harvest of carcinoma of the lung.
Dr. Guttman, could you maybe comment a little bit on some of the things you've sensed as far as the major changes?
Sorry, I've been under antibiotics and I can't hear a damn thing.
Can you comment on some of the major changes in the field of pathology, such as electron microscopy coming into being?
Well, I failed to mention one of the things that we introduced in the Sutter Hospital. There was a man by the name of Hall. You remember Hall? He was a gynecologist.
George Joyce Hall?
George Hall.
Oh, that phony bastard.
Well, George Hall would send me slides that he had a special stain for.
Yeah.
And he was primarily interested in the
Endometrial.
hormone
Yeah,
effects.
The endometrial hormone.
And I was relating things to interpretation of the hormonal effects, failing to realize that I had the Papa-Nicolau method in my hand at that time. With a little bit of an imagination, a little effort in that direction, we would have it. Because the cell looked beautiful, and if there are any malignant cells, you'd have been able to see it. Well, anyway, Papa-Nicolau was another innovation that came in, and it now constitutes a very large part of diagnostic medicine. I went to New York and looked over some of Papa-Nicolau's work, and his slides were so terrible I couldn't make heads or tails what he had. I had spent a whole month looking at it. He received more credit than due him. The credit really belongs to the gynecologist. What's his name? He came out here subsequently, University of California. He worked with this gynecologist. For a moment, I can't think of his name. But we began work on that afterwards, and developed into quite an active part of our diagnostic work in the early days.
Can you comment on the biggest change or the most memorable event in your life as a pathologist?
Well, I considered every day I worked here a memorable event because life was interesting to me. There was no outstanding activity. I think that I owe the society a great debt of gratitude for their kindness to me. I think that deserving or not, the name of the library and part of a blood bank in my name is a very kind gesture, and I appreciate this very much. I think very few of us have had the pleasure of having such preferential treatment by members of the society. It was a kindness that I should also always remember. Whether I was deserving or not, that's another question.
I think he's the only honorary member of the Society of Sacramento County Medical Society. Do you know of any other? I believe he's the only man listed as the honorary retired member of the Sacramento County Medical Society.
That sounds good.
So they don't give that honor very often.
Did you ever read J. Roy Jones's book?
J. Roy Jones?
You ever read his book?
Years ago, I read it, yes. He moved to Marin County, I believe, and he finished his book then. Didn't he write another second book?
Yes, he wrote one, Saddlebags in the Siskiyou.
Yes.
Doctors in Northern.
Yes.
Then he wrote a third book, The History of the California Society of Medicine, which was the original name of the California State Medical Society. And he wrote a fourth book on the history of the Cottonwood area in Siskiyou County, which is where he was born and raised. It was up above Wairika, above Hilt. His dad at one time had the store in this little town. He was the ticket agent for the railroad. He had the post office and the Wells Fargo business all rolled up into one.
Are there any other comments or questions?
Beautiful doodle.
Dr. Guttman, we're very grateful for all your contributions to our society, and we really thank you for coming up to Sacramento this evening to visit with us. We can break now and maybe let everyone chat again for a while. Thank you very much.
Well, thank you.
Well, we didn't get Oscar drunk. That's one we'll have to just serve
Yeah.
ourselves.
I thought the stories were awful clean and nice.